allow me today to introduce our first speaker, who is Dr. Tinuola Akinbolagbe, who is the Chief Executive Officer at the Private Sector Health Alliance in Nigeria, an organization which leverages on capabilities, assets, and resources of private sector to drive improvements in Nigerian health outcomes and achieve universal health coverage. A healthcare administrator with over 2 decades of experience in the health services in terms of her qualification, and then she is also involved in the financial and ICT sectors. She has experience spanning across strategic planning, operations, and risk management, particularly in the private sector, having worked at Lagoon and St. Nicholas Hospital. She holds a degree in medicine and surgery, graduating from the College of Medicine, University of Lagos. She also has a postgraduate diploma and a master's in public health from the London School of Hygiene and Tropical Medicines, University of London. She is actively involved in mentoring students and young professionals and works with several charities and non-profits to raise funds for community health initiatives. So allow me to welcome Dr. Tinuola to the forum, that she can take the stage to take us through what she has to share with us on the role of private sector in the healthcare development. Over to you, Dr. Tinuola.
Thank you, Audrey, for the very kind introduction and for the spirited attempt to pronounce my surname. It's actually Akinbolagbe, but no worries. Nobody gets it right. No problem. Yes, well, Akinbolagbe, it's a long one. Thank you for inviting me here. I'm really glad that the PPP Health4ALL platform decided to have this webinar and focus on the role of the private sector in the development of healthcare PPPs in Africa. I'd like to say a warm hello to my co-panelists, Dr. Ola, who I believe is also joining on behalf of Nigeria, and Dr. Trevor Gunn. So I'd like to go directly. Hi, Ola, how are you? Go directly to my slides now, if I may share my screen. Okay, please confirm once you can see my screen. Okay. So starting, what is the role of the private sector in the development of healthcare PPPs in Africa? By way of a background, Africa, as you mentioned earlier, has a large proportion of the disease burden in the world. To be specific, most of our healthcare expenses are paid out of pocket across the continent. And you find that a number of people are just one major illness away from the poverty line. We have more than 80% of the burden of non-communicable diseases and more than 15% of the world's population and 47% of the burden of communicable diseases. Yet, despite that heavy load, we have less than 2% of the global health expenditure. So there's an obvious imbalance in our disease burden versus how much is paid for health. In the course of the next few decades, you're going to have the fourth industrial revolution, where technology and innovation will take the forefront. Our population demographics in Africa is such that we tend to have more of the younger age bracket. And so over the next few decades, we'll have that transition into older people, and who we will then see an increasing burden in non-communicable diseases, which increase with age. And so that puts a further impact on our health security. We also have a huge disparity in the types of services and the quality of services available between the rural areas, the urban and suburban areas. And so definitely there is a need for us to have public-private partnerships, which can be used to improve financing capacity and come up with innovative models and provide the relevant architecture, which is necessary for our changing socioeconomic development and be able to get the full benefits of our human capital index. And so some of the characteristics of PPPs in Africa are detailed in this slide. We have long-term contracts. For instance, in the recent partnership between the federal government of Nigeria, Ministry of Health, and Garki Hospital, that I think was like a 15-year term. You need to have long-term contracts so that most people can make their returns and the necessary health outcomes can be achieved. So really for PPPs, it's more of a marathon and not a sprint. We also have risk allocation. You must have a clear strategy for allocating risk, the ones that will be borne by the public sector and the ones that will be borne by the private sector, investors, and other key stakeholders. Then there must be well-defined performance indicators. These are metrics that will be used at periodic periods along the process to confirm or indicate whether they're on track with the set objectives. And there must be government ownership of the assets at some point. Okay. So some of the drivers of PPP in Africa, which we mentioned a few earlier on, the desire to improve the public health service, the landscape of health services that are available so that we can have higher quality services. Also for the opportunity to leverage on the private sector, the funds and the resources available in that, and then have the benefit of that in the public sector. And this is not just in healthcare, but other sectors as well. A lot of the third driver is we have a lot of countries in Africa where a large proportion of their public services are funded by international non-profit partners. And so this organization needs to be formally recognized, and arrangements such as this need to be formalized. For a lot of those organizations, they do not look for returns on their investment. They do more of impact investment, but still there must be measurable metrics to ensure that the desired objectives are achieved. PPPs have been found to be one of the ways where we can foster development and work with insufficient funds that are available. I mean, there are huge burdens on the budgets of most African countries. So the private sector can step up to take the role of financing and supporting. And then as the private sector matures, you have more potential partners, both local partners and international partners in the private health sector. So background to PPP in Nigeria, some of the PPPs or successful PPPs, I must be honest, we've had some not so successful ones as well, but some of the successful ones that we've had, a lot of them are focused in the urban centers. We have in the Federal Medical Center in Ebutemeta, Garki Hospital in Abuja, which I mentioned earlier, the Lagos University Teaching Hospital, IBOM Specialist Hospital, LASU, which is the Lagos State University Teaching Hospital, and also UCH Ibadan, University College Hospital in Ibadan. It helped to define the relationship between public and private sector, and obviously we've had the effect of creating employment opportunities and the multiplier effect on the economy, and also helping to improve human capital development. The PPP model has been implemented in several sectors in Nigeria: aviation, power generation, transportation, education, and they have had varying degrees of success. But it's somewhat limited in the health sector, and it needs to become the mainstay rather than the exception. In 2005, the Nigerian government formally adopted the policy on public-private partnerships for health in order to address some of our very poor health indices. We have really poor health indices, particularly concerning maternal mortality and infant mortality ratios, and also a relatively low life expectancy when compared with similar economies in our region. So some of the contributions that PPPs could make to the achievement of universal healthcare access could be more discrete improvements in service or broad interventions at a strategic level. So from the technical expertise point of view, in Africa, we have the USAID Uganda Private Health Support Program. This has been used as a way to operationalize and implement the policy, the PPH policy, and put it into action. It also helps in the form of innovative financing. So when we look at Nigeria, for instance, we have the COVID Coalition against COVID-19, which was spearheaded by Alhaji Aliko Dangote, Mr. Demokode, Mr. Jim Ovia, Herbert Wigwe, and other private sector leaders. And they were able to raise over 30 billion naira to support the Nigerian government. And this was almost entirely from the private sector. I mean, it was the first of its kind in Africa and in Nigeria specifically. And I do think there's a lot of room to improve on that and replicate that in other areas of healthcare. Supply chain and logistics. The African Medical Supply Platform, at about the same time as the COVID initiative, this was spearheaded by the African Union, and you had Strive Masiwa and also other private sector players such as Novartis, COVAX, and the Rockefeller Foundation work on this. They worked on consumables and logistics to support the fight against the COVID pandemic. And then we have areas like healthcare delivery. So Pshan'S, which is the Private Sector Health Alliance of Nigeria, is taking the lead on what we call the Adopt a Healthcare Facility Program, where we're looking to deliver one global standard primary healthcare center in each of the local government areas of Nigeria. This is private sector funded, but leaning on the aegis of the National Primary Healthcare Development Agency, which is a government institution, and it's a good example of PPP. Also, we have the Nkosi Albert Lutuli Central Hospital in Durban in South Africa, which is also, it's a referral hospital and it's a partnership between the private and the public sector. So some of the challenges are quite obvious. Limited funds. We have, number one, an inadequate legal and regulatory framework. This needs to be well developed so that it's practically plug and play, I'd say, quite straightforward. But when we have PPPs and you have to reinvent the wheel each time, it makes it difficult. So there should be a concerted effort to have better legal and regulatory frameworks in place. And this should be driven by the public sector, by the government, because they stand to benefit the most. Secondly, we have a rather limited financial market, both in terms of capacity, actual funds available, and then the market size is small and quite fragmented. So we need to increase our global trade and investments and access to funding, you know. Also, there's a lack of technical skills to be able to manage this types of PPP programs and projects. In the healthcare sector particularly, we've seen a lot of brain drain, both in the actual delivery of healthcare services and even in more technical areas like this. And then also the unfavorable environment in a lot of countries. So for investors to come in, you need to have a perception of a stable economy. You need to have a stable population, no incidents of civil unrest or terrorism and things like that. And there also needs to be a lot of policy stability on the part of the government. And so that helps with risk assessment when investors do decide to come into such a country. So the future of PPPs in Africa. There are areas for large-scale investment. We can look at some of the issues that trouble us in Africa. I mean, we mentioned earlier on about the market being small and fragmented. That's not entirely true. A lot of the healthcare market is actually lost, and it runs into, at least for Nigeria, it runs into billions of dollars on an annual basis. And so if that market is available, I mean, then there will be a sizable market where investors can look to recoup some of their investments. So the medical tourism does drain a significant proportion of cash flow. And in countries like Nigeria, it also puts a strain on our forex availability. So we need to encourage capital investments and infrastructure upgrades. And the government needs to commit to healthcare transformation. We are looking at having some types of health villages where we can pool resources and expertise. The Lagos state government is looking at having a medical park called Medipark. It's estimated it would cost about 49 billion naira and will be able to offer a compendium of high quality, technologically cutting edge medical and diagnostic services. Another area is if we are able to improve the regulatory landscape. As we mentioned earlier, the government must proactively ensure that there are policies in place to aid the ease of doing business, particularly health business. We said earlier, health business is not a sprint, it's a marathon. But if handled properly, like any other business, there is room for investment and for good returns. We can look to providing some type of tax incentives and tax reliefs, and something as simple as just amending some of the company income tax laws that we have, and then encourage philanthropic endeavors into healthcare by the private sector. We need to better regulate our systems to reduce brain drain and also have a better maintenance culture. These are all things that can be done to encourage the private sector to invest in healthcare and in PPPs. Sustainable funding. We must position the private sector to be able to raise funds, receive foreign direct investments, and then invest those in PPPs. A lot of healthcare initiatives do require investments in infrastructure. And so if we have a stable economy and we have a welcoming environment and we have legislation in place, then we can accelerate FDIs to that sector. Also, when you have the tone of the government, the stance of the government, where they match funds. I mean, you have the Abuja Declaration of 2001, which was by African Union countries to have a minimum of 15% of the budgetary allocation be to health. I don't know any country that has managed to achieve that in over 20 years. A few countries are at about 12%, but Nigeria is firmly at about 5%. So those are areas that we need to focus on. Also, we cannot continue to have the proportion of our healthcare that is funded by international aid. In some countries, this is as high as 40 to 50%, whilst in, I think, Nigeria, we're probably hovering around 10%. So we must be able to mobilize domestic source of funding in order to invest in healthcare. A major issue that we have is trust. There's been a lack of trust or a loss of trust in the public sector by the private sector because of previous flip-flops that we've had in policies from the government and in changes. There's nobody interested in investing their money and losing it all due to flip-flops by the government. So the public sector must make a concerted effort to improve trust by the private sector and adopting a collaborative and transparent approach, and then build on the lessons that we've learned from PPPs that have been successful in aviation, in energy, in transportation. The instances where Chevron Nigeria has partnered with the NNPC, with the JV, and been quite successful in exploration and production of oil and gas resources. Also in Lagos State, we've had the government procure buses, which are run and managed by private logistics firms under the Lagos BRT.
Just mind the time. Can I just ask you to be winding up?
Thank you. I'm actually winding down. So this is my last slide. So our call to action is, in order to go faster, health businesses must align with increased sources of funding and work with venture capitalists. I'm sure Dr. Ola will say a lot more about that. And then telecom companies, people in oil and gas, and look to other sources of capital. African governments must strive for transparency and accountability in the use of resources deployed. Health is wealth, and for us to be able to unlock the full potential of our human capital and improve the wealth potential in the health sector, we do have to focus on PPPs and get the political will to make this happen. Thank you so much for listening.